The PSA blood test can save your life, or it can permanently change it. I know this sounds dramatic, but in oncology, this one number led to save lives and also tragedies. It's why we no longer see men with severely damaged bones from metastatic prostate cancer. And it is also why some men will end up with erectile dysfunction or urinary leakage after treatment for prostate cancer that would never have hurt them. I'm Dr. Michal Chovanec and I treat prostate cancer every day. And today I'm going to teach you how to read your PSA test like a professional, so you know when to worry and when to not panic. First, let's get one critical thing straight. PSA is prostate-specific antigen. It is not prostate cancer antigen. This means it is produced by prostate cells and also prostate cancer cells. So sometimes it is hard to distinguish what's real and what's not. So higher PSA does not automatically mean you have prostate cancer. It just means that there is something going on with the prostate. Before we talk about reading the number, we should decide whether you should get the number in the first place. Guidelines have changed. We are no longer getting a PSA number on every man after 50. And why? Because finding a low-risk, slowly growing prostate cancer can lead to unnecessary biopsies and unnecessary treatments that would never be needed. Today, the modern guidelines is shared decision-making. That means you only test if you understand and you accept the deal. The benefit, we might find an aggressive prostate cancer and save your life. The risk though, we find a low-risk prostate cancer that would never have hurt you, and you have to be strong to not rush into the treatment. Large European studies show that to save one man's life through screening, many other men, often a dozen or more, need to be diagnosed and treated unnecessarily. This is the price for using PSA alone, and this is why this decision-making is a shared decision-making between you and the doctor. The consequence number one is erectile dysfunction. So your erection is just damaged. You are not able to perform in your bedroom. Your sex life goes away. This is a natural consequence of removing the prostate and damaging the nerves that go very close to the prostate tissue. On the other hand, the incontinence, the urinary leakage, is a little less common side effect. The truth is, in my clinic, I see a lot of men suffering from incontinence, and they are saying to me, this is damaging my quality of life. So if we want to approach the PSA testing correctly, we need to be aware of all the consequences of doing the PSA and not doing the PSA, of doing the treatment and not doing the treatment. If you are 45 or 50 or more and you want to be proactive, get a baseline PSA, but just one. This baseline will help you predict the future risk. If it's very low, around 1 or below, you will not need any more PSA tests for several years. If it's higher, we watch you closely. To take the PSA test is a very deeply personal decision. If you decide to test, do not sabotage the result. What does it mean? PSA is extremely sensitive test. That means anything that is happening to prostate will make your PSA going up. This is a 48-hour rule to not get a false positive result. No cycling, no ejaculation, and no rectal exam 48 hours before your blood test for PSA is drawn. If you ignore these, you are getting a false positive result and you are putting a lot of unnecessary psychological pressure on yourself. Now you have the PSA number. For many years, doctors were relying on free PSA tests to decide what to do. Today we have better tools. What we really need to see is what is happening to your PSA over time and in context. Metric 1 is PSA velocity or speed. If you have PSA of 3, which is in a higher normal range, and it stays 3 for a year, that's reassuring. But if it jumps from 1.5 to 3 in a year, that is concerning. Cancer can grow fast. The benign tissue always grows slowly. The rapid rise in PSA is a red flag even if the number is still in the normal range. Metric 2 is PSA density, or the volume. If you have a very large prostate from benign enlargement, you are allowed to have higher normal number of PSA. Think of it like a factory. If you have a very large factory, it produces a lot of smoke that is normal. If you have a tiny factory that produces a lot of smoke, something is burning inside. That means in a normal prostate, you can have a cancer lesion that produces a lot of PSA. That's why density matters. We calculate this number by dividing your PSA by the volume of your prostate. So what if your PSA is high or is rising quickly? In the past, doctors were relying on blood subtypes like that free PSA test we mentioned earlier. Today, we are doing something much better. We use multi-parametric MRI. We stop guessing and we start looking at it. If your PSA is suspicious, do not rush for a biopsy. Always ask for MRI first. In many cases, a clean MRI will allow you to delay or avoid biopsy whatsoever. And if the MRI shows the suspicious area, it could be a tiny little spot, we can target that spot with a targeted biopsy and check if it's really real. The biopsies now are far more accurate and much less harmful than they were in the past. This modern approach spared countless men of unnecessary damage while still catching the harmful tumors early. So we need to summarize that PSA test is not a verdict, it's not a diagnosis, it's just a smoke detector. Step 1. Decide if you want to take the test. Step 2. If you want to take it, get ready for 48 hours to make sure it is spot on and you will not get a false positive result. Step 3. If you get a higher number, do not panic. Ask for MRI first to see what's going on. If this all helped you, subscribe and tell me in the comments, are you getting tested or are you waiting?